Hi, my name is Jessa Buenavista. I use the pronoun she, her. I'm a family nurse practitioner student at the University of Washington. I'm working with a preceptor today doing assessments. Could you please verify your name and date of birth for me?
Douglas Strauss, 12/24/89.
Okay, and what are your pronouns and how would you like to be addressed?
He, him, and you can call me Doug.
Okay, Doug, what brings you in today?
I'm here for a physical examination.
Okay, so at this point, I'm doing a general assessment of my patient, making sure it's not any distress or any medical condition I need to address right away. So today we're going to be doing a head, eyes, ears, nose, throat assessment, and we're going to start with head, okay?
All right.
So I'm looking at your face, looking at symmetry, no cyanosis noted. I'm also looking at facial hair, and I'm going to go ahead and look in your head there. Is it okay if I touch your hair?
Yes.
Okay. So I'm looking at hair distribution, any hair loss, and I'm also parting his hair, looking for any infestation, any masses, lesions, and I'm also going to palpate. Do you feel any tenderness?
Negative.
Okay, good. And I'm just checking for deformities, and everything looks good. Alrighty, so I'm going to go ahead and palpate your TMJ. Fingers just right in front of the tragus. Go ahead and open and close. Okay, so no redness or swelling, no snapping or clicking. Alright, so now I'm going to move on to your eyes, okay? So I'm looking at your eyes, looking at your lashes, your lids, looking at your lacrimal glands and sac, looking at your conjunctiva. I'm going to go ahead and pull your lids down. It's pink, clear as white, no tearing, no edema, no redness. How's your vision, Doug?
Really good.
Good. Okay, so I'm going to have you look into a chart there and we're going to check your vision, okay?
Okay.
And this is checking his cranial nerves number 2. So go ahead and cover one eye for me, please. Go ahead and read the smallest sign you see.
LTFPH.
Okay, and cover the other eye.
LTFPH.
Okay, visual acuity is 20/20. Alrighty, so now I'm going to check on your peripherals. This is checking cranial nerves number 2, 4, and 6. I'm going to have you cover one eye for me. And my finger's going to come from behind you and let me know if my fingers come to the line of sight, okay?
Yep. Yep.
Other side.
Yep. Yep.
Okay, cranial nerves 2, 4, and 6 are intact. Okay, so now we're going to be checking your eyes. I'm going to dim the lights here because I'm going to shine a light on your eyes, okay?
Okay.
So go ahead and look straight. Okay, direct, consensual, direct, consensual. Alrighty, and then I'm gonna have you follow my pen without moving your head. Alright, cranial nerves 3, 4, and 6 are intact. Okay. So now I'm going to be looking in your fundus into your eyes. I'm going to have you look into the distance there and try to keep still. Okay. So I am standing about 15 inches away from my patient. As I see the red light reflex, I brace and I get closer. I'm looking at the optic disc. It's flat. Veins and arteries, no hemorrhage, no exudates, no AV nicking. Looking at the macula, no lesions. And I'm going to have you look into the light there, and I'm just checking on the fovea. Okay, good. I'm going to do it on the other side without talking. Okay, everything was good. Alrighty, bright lights here, okay? So now we're going to move on to your ears. So I'm looking at your ears there, the external part of your ear, there's no redness or swelling. I'm going to go ahead and palpate any tenderness.
Negative.
Okay, I'm just palpating his tragus and his mastoid, any tenderness.
Negative.
Okay, and then I'm going to look at the external of the ear, making sure that there's no drainage, no foreign bodies in there. Okay, so I'm going to look into your ear, okay?
Sounds good.
All right, how's your hearing, Doug?
Really good.
Okay. So let's go ahead and test that. All right, so I'm gonna have you close your eyes for me and let me know where you hear the rubbing.
My left ear,
Okay.
my right ear, and both.
Perfect. All right, so I'm gonna look right into your ear there. Sorry about that.
You're all right.
Okay. Give me a minute here. Okay. Corey, gotta make sure that's clean, okay? All right, so I'm gonna look into your ear canal there. I'm gonna brace as I pull his ear up and back. Okay, there is no drainage, no redness or swelling. Ear canals are clear. Tympanic membrane, pearlish gray, translucent, good cone of light, and distinct bony landmarks. Okay, I'm gonna do that on the other ear without talking. Okay, good. Alrighty. So now we are gonna move on to your nose. Okay. Do you have any problems smelling?
Negative.
Pleasant or unpleasant?
Negative.
Okay, so I'm gonna go ahead and inspect your nose, make sure there's no lesions, no masses. I'm gonna palpate. Looks like there's no deviations. Do you have any problems breathing?
Negative.
Okay, so I'm gonna have you occlude one ear and then go ahead and breathe in, out, other one. No. Yeah, any problems breathing?
Nope.
Okay, good. So I'm gonna look into your nose there. Okay, so I'm gonna have you tilt your head up and I'm gonna hold the tip of the nose there very gently. I'm gonna look at the external part of his nose, so it looks like there's no drainage, no redness or swelling. I'm gonna look in there and mucosa is pink, moist. There is no bleeding or polyps. Same thing on the other side. Okay, good. Alrighty. So now we are going to move on to your mouth. So I'm looking at your lips. It's pink, no ulceration, no cracking. Let me just grab the tongue blade here so I can look into your mouth closely there. Okay. Alright, so go ahead and open. I am looking at his buccal mucosa. It is pink, hard palate, soft palate. Also looking at his gums. There's no white patches. There's no ulcerations, no lesions, no redness or swelling. Look at his teeth. Looks like it is in good repair and in good dental condition. Alrighty. Now we're going to test cranial nerve number 10. I'm going to have you open your mouth and say ah. Alright. Okay. So I am checking out rising and falling at the uvula. Cranial nerve number 10 is intact. And also looking at his tonsils. It looks like it is non-tender, no swelling, no redness. And then I'm going to have you stick your tongue out and then go ahead and move it side to side and then up and down. All right, everything looks good. Alrighty, so now we're going to move on to your neck. Okay, so I'm looking at your neck for the skin of your neck. For any discolorations, if there's any moles, also looking at your trachea, midline, go ahead and tilt your head up. And then go ahead and swallow. Any tenderness?
Nope.
Okay. I'm gonna have you, I'm gonna check the range of motion of your neck. So go ahead and look up to the sky and down and then side to side. Okay, any pain or tenderness there?
Nope.
Okay, good. So now I'm going to be palpating your lymph nodes, okay? Alrighty. So I'm gonna start with the preocular, postocular, occipital, superficial, deep, posterior, tonsillar, mandibular, mental, submentalis, supraclavicular and infraclavicular. Okay, so now I'm gonna go ahead and check your thyroid gland. I'm gonna go right behind you and palpate your thyroid. Is that okay?
Yes.
All right. I'm gonna put my hands around your neck here.
Okay.
I'm gonna look for the cricoid cartilage, and then just inferior to that is the thyroid gland. Okay. So I'm gonna have you go ahead and swallow. All right. So I'm gonna have you tilt your head down and to your left, and that's releasing the sternocleidomastoid, and I am examining with my left. And go ahead and relax, down to your right, examining with my right. Okay, good. There is no nodules felt. Alrighty, so now we're gonna move on to your spine. I'm gonna check on your C-spine there, just on the base of the skull, and I'm gonna palpate for the bony prominence. Any tenderness, Doug?
Negative.
Okay. And I'm also gonna check on his spinal muscles there. I'm gonna start with the neck, traps, and the scapular spine. Do you feel any tenderness or pain?
Negative.
Okay, good. All right, do you have any questions for me?
No, I think it was fantastic.
Okay, so that concludes our head, ears, eyes, nose, throat assessment.